In early April, I think about April 5, I got a fever. Got a little worse over the next few days, went in with a good explanation of what I might have, which wasn't COVID, but in fact the COVID test was positive. Lakeland, like most hospitals around the country, was in a full-time effort to prepare for COVID, and I was in the midst of that effort. I was doing everything that we were trying to do, teach everybody to do. I'm not sure where I caught it. I think I probably caught it rounding on the COVID wards at a time when the only people who had masks were the nurses who went into the room. I was admitted to Lakeland, was here for about 3 days, got progressively worse. Our team, collaborating with Spectrum in Grand Rapids, thought it might be good to transfer there. There might be some therapy that could be available a day or two earlier. So I was transferred by ambulance to the ICU in Grand Rapids, continued to get worse, and ended up on the ventilator. My sense was that my best odds are about 50-50 on the ventilator of coming off. And given how rapidly I was getting worse without any other health issues, I thought probably my odds were more like about 1 in 10 to come off. It got bad. I was not sure when I called my wife with about 5 minutes warning that I was going on the ventilator that wouldn't be the last conversation. When I came off the ventilator, I felt very short of breath, and that lasted Thursday night and Friday night. And Saturday, my lungs dramatically improved. And then the next day, I could do okay with no oxygen. And I came home with oxygen, expecting to need it, and have not needed it. In terms of medical intervention, I think the convalescent serum was key. I would implore anybody that can donate serum to do so. It saves lives. I believe if I had not received convalescent serum, that I probably would have died. The response of my Lakeland team is just remarkable. As I got worse, my colleagues came together in prayer at the end of the day from different faiths and denominations. As Lauren walked the halls, he had repeated contact with those who wanted to express that they were deep in prayer, express how painful it was for them, offering encouragement and support. I consider myself fortunate to have the team, fortunate to have people around me willing to pray, fortunate to have not gotten it a week earlier or two when some of this therapy would not have been available. When you have an experience like this, it does open your eyes to be thoughtful to the time you have. How would you like to spend that time? Who would you like to spend it with? My head is off to the team, their heart, their culture, their willingness to reach out and to provide support beyond what anybody is called to do in a workplace.